I am really worried that Hillary is too sick to be president. We need her to release her medical records for at least the last 5 years so we can all find out the truth. Now, I know what you're thinking. I'm on the Trump train, and this is just the latest reason that I'm coming up with to give you all for why you should vote for Trump and not Hillary. But that really isn't true. I care about the fact that the President of the United States should be in excellent physical and mental shape, and there are certainly enough things that make us question Hillary. Now, first let me tell you, I'm a medical doctor, I'm a psychiatrist, I've been certified by the American Board of Psychiatry and Neurology. I have been trained in this. I have treated countless numbers of patients, so I kind of know what I'm talking about. I know how to read information and how to look at videos and photographs and tell that there are things that are psychologically or physically wrong with someone. Now, there's the caveat, of course. I have not personally examined Hillary. I have not seen her medical records, nor just like you. And that's why I'm calling for them to be released. There have been some medical records recently that were released, supposedly by an employee of her personal physician, Dr. Lisa Bardock, that really contain some very worrying facts. Now, there's a question about whether these records are fake or not, and in fact, Dr. Bardock has recently come out to say that they are fake. And I will admit that the heading of the stationery doesn't look exactly right. However, the content could not have been written by someone who wasn't a doctor. That looks absolutely correct. And in these records, they diagnose Hillary as having complex partial seizures and subcortical vascular dementia. Now, we know that she had a fall in 2012 that caused her to have a concussion, which would mean that there was some brain damage. And we know that she has some thromboses, some blood clots in the brain, in the blood vessels related to her brain. Those things aren't up for grabs. We know that already. Now, Lisa Bardock coming out and saying that these are fake and so on, she doesn't specifically address the content and say that that's wrong, but she's saying that the form, that the records, the way they are fake. But she came out originally and said that Hillary was fit and healthy to be president. So is she likely to now say, uh-oh, I lied? She really has dementia and she still has brain damage and seizures and so on? That's that's really a bad situation, although of course one would hope that she would. But still, you don't need to be a psychiatrist or a neurologist to watch the videos of Hillary and to see that there is something wrong. If just look at the videos where she's talking to some reporters and suddenly her head starts jerking back and she tries to cover by pretending that she's laughing, which is very inappropriate to the context of what's going on. And she changes the subject and she starts talking about chai tea. I mean, really. and you can look at the faces of the reporters and see that they're rather shocked and are trying to pretend that it's all fine. And then there are other videos of her talking to a large audience of people where she has what looks like a brain freeze. She loses her concentration. She loses track of what she's talking about. And this is typical. These kinds of symptoms are typical of someone who has had these physical problems. Also, as well as the poor concentration and confusion and poor memory issues and inappropriate kinds of emotional reactions and so on. Now, I have a friend who's a lot younger than Hillary who recently had blood clots in the same places as Hillary did. And she is now not able to work, and her job was a lot less stressful than being president of the United States. Now she's getting therapy, and hopefully she will get better. But it's always very unlikely that someone with these kinds of diagnoses can get better 100%. And better, how much better do you need to be president of the United States? Certainly, you need to be 100%. So these things are very worrying, and certainly, although regardless of whatever political persuasion you are, certainly we can all agree that it is important to see the medical records of the candidates, not just Hillary. Trump should release his too. But we should see what is really going on. I mean, we haven't had reason, other than people are saying in the news, Trump eats junk food. Okay, yes, and he's a little overweight, yes. But okay, yes, he should release his medical records too. But we need to see the physical state of our candidates before we vote.